Dr. Srikanth, is there anybody else from the attendees group which you can see that we have to add to the panelist here? I think we just need Dr. Jagdish, right?
Yes, we need Dr. Jagdish. I don't know why. I'll just check with him once.
Yeah, just check with him so that maximum by 3:05 or 3:10 we should start.
Did you have a word with Dr. Jagdish, sir?
I didn't call him, sir, but I left a message in the morning. He said, yes, he'll come.
No, మేము కనెక్షన్ టెస్ట్ చేస్తున్నాము. నువ్వు ఒక్కడే లేవు అందులో. లేదు కనెక్షన్ టెస్ట్ చేస్తానికి మనం ఇప్పుడు Dr. Jagdishwar will be coming online.
All right, sir. I think Dr. Karnakar, sir, would you like me to put the slides, or have you made any changes to the presentation?
No, slides we are not done. Dr. Srikanth said he will be focusing the slides.
We have all the slides. So I'll share the screen. I'll share the screen, sir. Because see, unlike the other CMEs or presentation, this is directly guidelines. What is written only we want to talk. What is not written, there is no point in talking about it. Questions will come up. We'll discuss it at the time of questions. No guidelines will ever be complete.
Yes.
If there is some query, we'll discuss. But that's the reason I kept the content very strictly only limited to the guidelines. What is written, in fact, I had to pick up the same words. Konisarlu manam words marcheste meaning maripotadani, I didn't change the words also.
Yeah, I do agree.
Yeah, so I've just limited. I'll just try to pull up the presentations. I welcome Dr. Nagendra. He's our colleague. Dr. Nagendra, could you just check if the YouTube link is active?
Yeah, hi, good afternoon, everyone. So I think, do you want me to see the live streaming video?
Live stream, yeah, wherever it, we had given one particular link. So adi vastundi ledu ani I'll also check. Yeah.
Dr. Sri Krishna, can you hear me?
Yeah, cheppandi.
Because the scheduled time is 2, it will start live streaming from 2 only.
Only at 3. At 3, so it will start streaming only at 3.
Correct.
Okay, all right. So I get it. So this నాకు కూడా అదే చూపించింది, but I thought I'll just ask somebody else as well, and that should be fine. Nagendra, you have your set presentation or videos ready, right?
Can I check my share screening once?
Yeah, it's visible. Dr. Sanjeev is stuck in something else. So, sir, you have any clue who is COVID update? Srikanth, sir?
I'm not sure about those names, but the thing is, even I'm not able to see the participants here. Just hold on.
See, మీరు పక్కన attendees అని ఉంది, అక్కడ చూడండి. You also have some question and answers and chat. So somebody called COVID update has put up something in the chat box. I don't mind as long as people talk, but if we know who they are, we can at least get back to them if they talk something inappropriate. Right, so just give me a minute, I'll return back. I think we're all set. Once Dr. Nagendra's screen is also visible. Nagendra, I'll just stop sharing.
I'm not the one who is sharing the screen. I think Dr. Srikanth is
okay, Dr.
sharing
Srikanth is sharing.
Right.
Sharing? All right. Okay. I'll just stop him for a minute so that I can, Dr. Srikanth's screen. I'll just test mine so that it's easy. So this will be the intro slide. I think this is okay. So even if we start about 5 to 10 minutes late, this will be there. And in the beginning itself, I'll be putting up the poll. Okay, so let me just show you the poll. Meeku emana kanpistunda poll?
No, now it is opening slide.
Yeah, okay, fine. So unless I click on launch poll, it won't get launched. So I just have a couple of questions. I think around 3:05, 3:07, around that time, I'll put the poll. Dr. Srikanth, we start with a small welcome address and the relevance of this. I'll talk. You please then take over and talk about the role of IDA. What is the importance of these guidelines for all of us now that it has come from Government of India directly? And what is the plan of action as an association also? If you intend to do this one more session also, you can mention. We'll be happy to support that.
Yes.
And soon after you finish, then I'll put up the poll. We will have about 3 minutes for the poll to be answered by all of them. As soon as the poll is over.
Setting చేస్తుంది
రైట్ మీరు వీడియో ఆన్ చేయాలి.
వీడియో ఆన్ చేస్తుంది అందుకే అదే మధ్యలో కొంచెం ప్రాబ్లం వచ్చింది.
ప్లీజ్ గో ఆన్ డాక్టర్ శ్రీకృష్ణ.
So as the poll is going on, then you can request people from IDA, whoever, Dr. Karnakar, Dr. Jagdish, to give their inaugural remarks. I think once the poll ends, 3:10 to 3:15, that is when we intend to start as per the agenda again. I think I put up the agenda also here. So this is how it is. So maximum by 3:15 to 3:20, we should be ready to start. We'll ask I request Dr. Karnakar also to say a few words in the beginning. And then after the inaugural remarks, 3:20 as per schedule, I'll start my presentation. Mine is an overview. It's an overview in the strict sense. I'm just looking at 5 or 6 very key important points related to COVID in general, not just for dental alone. And then we have Dr. Nagendra in 15 minutes. He'll have a short session on infection control and PPE. This is again general for all of us. After that, 3:50, we go into the first session. Dr. Jagdishwars, I've already shared the slide with you. It's the same content. I've just put it up into a slide format. And then also Dr. Karnakar. So 4:20 is the time when we finish all the 4 sessions. And that is when we'll take up discussions. One of us, either me or Nagendra, will ensure that there are questions which come up in the chat box. We'll keep note of it. And will enable discussion, and I'm sure people will interact much more in person also at the time of open house. And I'll put up in the message box as well that anyone who's keen to interact can raise their hand, and we'll enable them to talk in person as well. So that's the plan. Just give me a couple of minutes. I'll just be back.
Dr. Sri Krishna, can I check my share screen?
Yeah, I'll stop mine. Yeah, please.
How to safely put on personal protective equipment, or more commonly called PPE.
Can you able to hear the video, Dr. Sri Krishna?
Yeah, audio, video, both on.
Okay, great.
Yes, sir. It's video up. Audio. రిత్విక్ ఒకసారి వీడియో సెట్ చేసేలో ఇందులో ఆడియో వస్తుందా?
Dr. Sri Krishna, you are there?
Yeah, tell me.
What I'm saying is it possible for the is it possible for the participants to be seen, or only the panelists?
Yeah. I think the panelists will be seen. The participants can participate at the time of interaction. That's the webinar concept.
Okay.
So unlike a meeting where all of us are in the same group and then we constantly have disturbance.
Yes.
All right, just give me a minute so that we set up and then we'll start in a minute.
Yeah.
Forward just.
9523 977 577 9.
Good afternoon, everyone. On behalf of UNICEF Hyderabad Field Office and the Indian Dental Association, the Deccan branch, including the Telangana state, I welcome you all. I'm so sorry, we had to just mute the live YouTube channel. Welcome you all for today's webinar. This webinar is a specific webinar oriented towards dental professionals during the current COVID pandemic situation. And we are here to brief you, discuss, deliberate, and understand the Government of India guidelines for all the dental professionals. And we'll be starting the program shortly. You'll be muted through the session. We have 4 panelists with us today. Please share your queries in the chat box with all the panelists. And we'll be enabling discussion after 2 sessions. So we have 1 session on the guidelines for COVID, which is generic for all the health professionals. And then we'll discuss specifically the GUI guidelines. Feel free to introduce yourself, share your thoughts, experiences, queries, and remarks in the chat box, and we'll ensure that we discuss all of them over the next 2 hours. At the outset, I request Dr. Srikanth, Secretary IDA Deccan, to please say a few words, and then I'll request both our faculty members today, Dr. Karnakar and Dr. Jagdish, to please give their inaugural remarks. Dr. Srikanth, please.
Thank you very much for your kind words of introduction, Dr. Sri Krishna. On behalf of the President and the Executive Committee of Indian Dental Association Deccan Branch and also IDA Telangana, I welcome all the members for this webinar. And I also welcome Dr. Nagendra Guwala, or one of the panelist speakers, and Dr. P. Karnakar, who is also the principal of Pania Dental College and has been a pillar of support for Indian Dental Association, not only at Deccan branch level, not only at the state, but also for the entire country. And not to mention about Dr. Jagdishwar Rao. I don't see him coming on the screen. Dr. Jagdishwar Rao is a professor at GDC Usmania, GDC Government Dental Colleges and Hospital, Hyderabad, and has served in many posts, centrals and as well as in IDA, and has been very active in most of the IDA programs. This is one of the unique programs which we are coming across in this part of the year, when exactly last year we were doing around 40 to 50 programs, and we were almost on the national level on the highest number of programs what we had done. But desperate times call for desperate measures. I hope you agree, and that's why we are having these online sessions. Thanks to the technological breakthrough and technological revolutions, we are able to still get connected. And I see a lot of participants joining in as I'm talking. So let's have a good healthy session to understand what exactly and how exactly are we supposed to play by these guidelines, because these guidelines in the last lockdown period of 1.5 to 2 months, every other day there was a guideline either from DCI, from IDA, from a local branch, from a state branch, or from some other body or something other. That was a little bit confusion. But these final guidelines, it has come just last week, by the Government of India, Minister of Health and Family Welfare, lays down the final guidelines. But as you say, Dr. Sri Krishna, guidelines might be modified over a period of time, but let us understand what guidelines we have right as of now. Okay, so I welcome you all once again for this webinar program. It is very important that we stay updated, and very important. I see a lot of participation from other states also. Right now I can see from Haryana and even from New Delhi, because we have given the information to almost all the doctors. I think most of them are from our state and our branch, and let's have a good healthy discussion after this presentation also. Over to you, Dr. Sri Krishna.
Thank you, Dr. Srikanth. Dr. Karnakar, sir, we'd like to hear from you.
Yeah, good afternoon, Dr. Sri Krishna, Mr. Nagendra, and Dr. Srikanth, for taking this wonderful initiative at the time of crisis COVID-19. And UNICEF is always there for the nationwide activities. Particularly, this particular program is required and need of the hour for the Dental Association and also for the members across the globe. However, I see many of my colleagues and friends, dear friends across the country, from Haryana, Delhi, UP, Karnataka, Telangana, all over. And also the guidelines which are prescribed by the Government of India, Government of Telangana, and Government of other states are given different guidelines. We need to give some confidence, as all our dental surgeons are well equipped with their protocols. And also, I'm very sure that our dental surgeons are very competent if you compare with the dental surgeons across the globe. Particularly in this part of Telangana, they are well trained with their skills, talents. Only it just needs that little more organized working. We will be through this hour of crisis. Once again, I thank Dr. Sri Krishna for taking up this initiative. A lot of guidelines which are going to project are going to be very, very useful and informative to the people. As I always feel that earlier we used to say we are all sailing in the same boat. It's not same now. We are not sailing in the same boat, but we are in the same storm. So we will just pass through this. And I'm very sure that all our dental surgeons will be benefited through this program. Whoever have joined this program, I sincerely thank them for taking the time in the most toughest part of the day, that is in the afternoon of the post-lunch session. Thank you very much for UNICEF taking up this program.
Dr. Srikant, do we have Dr. Jagdish available? If he's there in the attendees group, we could promote him to the panelist group. While we wait for Dr. Jagdish to come, it's time for the poll. A poll is usually an indication of where we stand with respect to our understanding, and also what the key points which we have to take as a take-home message from this particular session. Request all of you to please answer this poll. Your identity will not be revealed. Even I won't know who has answered which question, but this just comes up as a percentage. So request all of you to please take up this poll, and the same poll will be put up towards the end as well. And if there are any queries, especially concerning these important points, we'll be happy to clarify them at the end as well. And you'll find these answers during the sessions as well. A few notifications through the session, like a webinar through Zoom. The attendees will be in a separate group. You will be able to post questions primarily to the panelists. If there's anything that you would like to talk, we request you to please raise your hand at the time of interaction. So just like a physical meeting where you'll be given the mic and then you'll use the opportunity to convey your thoughts and express what you are keen to share. A same process even here as well. The only difference is that you'll be muted and unmuted. That's the only difference. So please raise your hand at the time of interaction. And through the next 2 hours, we're here to discuss what are the current Government of India guidelines. I know a lot of us have doubts, questions related to what government is doing, what is happening around us, and we all feel there could be a better way to do these things. Trust me, even I do. Even I feel the government, even WHO needs to do it in a certain format, which I feel is a better way. But we're not here for that purpose. And I'm not sure if we'll be able to find answers for a few things. And the concern is the same. We do understand that you are having a few good ideas and would like to convey these. And so most of us do. But today's agenda is primarily to discuss what has been put up in the guidelines. I'm sure some of us may not agree with some of those guidelines. We may feel we have a better option and a better way of doing things. Let's discuss that in detail at the time of interaction. But the agenda today is to discuss what has been put up in the guidelines and a few things which are very important for us as we start to open up our practice. There's a lot of fear amongst all the healthcare professionals that this is an unprecedented event, and are we really doing the right thing? At the outset, let me tell you, it's difficult for us to judge what is right and wrong right now. What we know is what is deemed to be right as dictated and told to us by the government and also by our professional associations. So in all fairness, these agencies are probably well informed, are in a good position to take up decisions, and also will be responsible for the actions and consequences. So let me say, as we discuss these Government of India guidelines, let us trust them, let us follow them in their entirety, whether we are totally convinced or not. Now, as per the current situation, we are obliged to follow these guidelines. Request all of you to please understand them clear all your queries. We have experts here who can answer most of your questions, if not all. And let us go back from this webinar with much better information, which will help us to practice our skills and help us in offering the same kind of quality service that we did earlier. The link is also live on YouTube. If you would like to see these sessions again, you will be able to by just clicking on that particular link. And I'm hopeful that many of us will be able to share this. And I request IDA Telangana also to share this with the other agencies and also the other branches and associations. So I'll be ending the poll now, and we'll take up these poll questions and discuss on them later.
Dr. Sri Krishna, are people doing the poll? Is the poll process on?
Yes, sir. So yes. We have about 65% of them, but I think there are just 3 questions, and we will try to put this poll up again later as well.
Yes.
Okay. Yes. So I think now we are not on time. 3:20. We wanted to start the first session, and the session is on general COVID. Few important things which we wanted all of you to know, and we'll take that up now.
And hopefully after this session and after these presentations, we will be having follow-up sessions and follow-up webinar sessions at a convenient time, because nowadays, after the lockdown is over, mostly evening times, most of the practitioners are free, because it's all a morning practice, a day practice.
Yeah, and let me assure you full support from our end, from UNICEF's end, and we will be around to help you organize these sessions. And if you need any experts, because we work directly with the stakeholders of governments, if you need any expert sector to pitch in and answer a few queries, especially related to management or what has been the thought process behind these guidelines, we'll be happy to do that as well. I think with these introductory words, and also now that we've finished the poll, I request Dr. Nagendra to please respond to any chat queries. I'll be proceeding with the first session. Dr. Srikanth, can I start the first session on the overview?
Yeah, Dr. Sri Krishna, thank you very much. Do we have 2 hands up on the screen? Do we take them now?
Yes.
Or
yeah, we'll just, I'll ask them to, if it's, I think I have the name Sudarshan. I'm just allowing Sudarshan to talk. Please.
Yes. Dr. Sudarshan, please tell your query. I think do we have to unmute him or something?
No, I just unmuted him.
Okay.
But I think he needs to also press it and then talk. Yeah, he's available now. Dr. Sudarshan, go ahead.
Yeah, good afternoon to you all. Just I want to say hello to you all by inviting me. And it's a very nice discussion about. In between, I'll add on in the legal areas. Hello, can you hear me?
Yes.
Yes, sir, hear you, and please join us in the interaction as well. Please share your thoughts. These guidelines are, I mean, they are applicable for those who are working in the metros as well as in the towns and the cities. So I'm sure we'll hear from towards the end as well. We'll proceed with the session. Thank you. Right, so let's quickly go to the first session, and the first session is on understanding COVID and where we are with respect to, where we are with respect to the current status and what needs to be done. So this presentation is not about basics of COVID. I didn't want us to start from there, because many of us, as you are aware, we've got a WhatsApp university and then a lot of information that we see. I wanted to specifically take you through those segments that are important to us in the current context. So this presentation is specifically tailored for us in the current context. And let me take you over the next 20 minutes through this particular session. This is an overview of COVID, applicable, relevant for all of us. Let us start with current status, and this is very nice for us. We always want to look at numbers, see where we are heading, where we are going. At the outset, let me tell you, if there is one specific portal for you to look at, it will be the WHO's international dashboard. If you want to know what's happening around the world, do not go to BBC, CNN, or any of the media channels. News is something which is exciting and which engages people's attention. That is the definition for the media. But for us, news is about what is happening. So if you would like to know the real numbers, then go to the agency and the resource which we all can trust. So please go down to this particular dashboard on WHO's website. If you press on, if you click on WHO's website, it will take you to this particular dashboard. And this is a constantly active and being updated web page. So if you can see, as of now, today morning, there have been 51,65,481 confirmed cases and these many deaths. And this is exactly the current position as we speak now. That's the global position. Now, what are we looking for in our own country? Again, I repeat, there'll be a lot of websites with COVID-19 as a prefix, and then you presume that's the real numbers. We have to work with whatever the government is giving us as information officially. Maybe underreported, overreported, hidden, but whatever it is, this is what we depend upon. This is our resource. So please trust and go through the ministry's website. I'm putting up the page which I took up exactly about half an hour before the webinar started. So as we speak, the current numbers of COVID, 73,560 active cases and 3,867 deaths. This is what is reported on the COVID-19 dashboard of our country webpage. Next is coming to resources. Lot of resources. You have right from Lancet till our own state government, including all the associations sharing a lot of resources. What do you preferentially use your time to read? I would suggest that you have a look at primarily these three areas. One is the WHO website and also their resources. You'll understand because different countries are in different stages and WHO is in the best position to make everybody aware of where each one of us is. So this particular orange colored document cover page which you see has been released just 2 days back, and it talks of the interim guidance for clinical management of COVID. So all your questions on whether steroids are being used, plasma therapy, all those questions you will find resourceful answers and also with evidence in the documents by WHO. Government of Telangana also keeps sharing on its own Twitter and web page these documents which tell us about treatment, resources, and much tailored to our context in the state. I would also advise you to go further down on the ministry's webpage. As you can see here, the ministry's webpage has latest updates. You have one released a few hours back, which is guidance to international travelers or arrivals. So like this, the entire webpage has got a big list of resources. If you would like to know what is happening on field and what you should trust, these are your resources. Now, coming back to COVID, the definitions stay the same. Whatever be the current scenario over years and decades, a probable case is a suspect case for whom the report from a laboratory test is inconclusive, and if it is confirmed irrespective of the signs and symptoms, if a lab test is confirming COVID infection, then it is a confirmed case. A contact, the definition keeps varying. It changes with time, context, and also the country. Right now, the contact is someone who has within the last 14 days either provided care to the COVID patient, has stayed in the same environment, could be at work or could have been at home, and has at least traveled in close proximity, literally by sitting beside each other over a journey or during public transport. This is the definition which I picked up from the WHO's interim guidance note released 2 days back. So this is the present clinical presentation, and this is from those 51 lakh cases which have been confirmed positive. And this database is very informative for us. So WHO says that most of them experience fever, cough in only 59 to 82%, fatigue, anorexia, shortness of breath in about 40%, myalgias in 10 to 35%. So cough is not in all the cases. Breathlessness is not in all the cases. This is the relative percentages. There are other non-specific symptoms like sore throat, nasal congestion, headache, diarrhea. They even have added anosmia recently in the current clinical symptoms list, which was not there a month back. So loss of smell preceding the onset of respiratory symptoms has also been reported. Now, older people and those who are immunosuppressed may present with atypical symptoms like fatigue, reduced alertness, reduced mobility, diarrhea, and even delirium, all this with absence of fever. And this is specifically mentioned by the WHO in the clinical presentation. Symptoms like dyspnea, fever, GI symptoms, and fatigue due to physiological adaptations in pregnant women may overlap with the symptoms of COVID. Compared to adults, children, as we know, are less likely to present with fever, cough, and breathlessness. What are the risk factors? They stay the same. Age more than 60 years, and the risk increases with age. Underlying non-communicable disease like hypertension, cardiac illness, cerebrovascular disorders, diabetes, immunocompromised state, and specific mention of smoking. So these are the specific risk factors which are associated with COVID as we speak right now in the month of May. Modes of transmission, this slide is very, very important to us, and we need to keep looking at it. There is high probability we'll forget all this and only keep understanding plasma therapy or how do we perform a dental surgery. The mode of transmission stays the same. It is still spread by contact. Please understand that the virus droplets, when they are released, they get onto your hand, you touch somebody or in a surface, the virus particles get transferred. It might so happen that the person is not even around you. This person in the blue shirt has probably coughed out the virus particles. They have landed, as you can see here, on these chairs. And these two people came an hour later or a few hours later, kept their hands on these chairs, picked up the virus, and now the virus is on their hands. And if this hand now reaches the mucosal surfaces, that is the portal of entry. And the mucosal surfaces are your mouth, nasal mucosa, and even your eyes. So this is the mode of transmission. Very important for us to keep reviewing and telling ourselves, this is the way it transmits. This is the way it does not transmit. The fine dust particles which you see traveling from one end of this person to the other end is not COVID. COVID particles are heavy. They are more than 5 microns. They get dispersed into small powder-like particles only during an aerosol generation procedure. See, a lot of context, clinical spectrum, everything can change. But what can't change is the basic microbiology of the organism. It can't suddenly become smaller in size. It continues to be more than 5 microns. It drops down within 3 feet. So the precautions which are necessary continue to stay the same. Only during a specific procedure like intubation or during any form of pulmonary procedure, that is when these particles are liable to become smaller, get dispersed in the air, and then remain suspended and can spread. Otherwise, they are heavy particles, bigger in size, fall within 3 feet, spread us by contact. It is not by air. It is contact with indirect or direct contact. This has not changed. Never mind the 56 lakh cases, this has always stayed the same. And other thing which has stayed the same and we are understanding much more is the concept of the iceberg in case of COVID. We know that 80% of the cases are mild. They don't reach out to us. They are not symptomatic, or even if they are mildly symptomatic. They don't need a doctor. How many times have we gone for a little fever or a slight cold? It's the same with COVID. They do not reach out to the doctor, so you never know if the patient is actually having a virus. 80% of them are mild and continue to stay at home. But the problem is the propensity to spread. 1 out of every 6 people can become seriously ill, and the transmission is higher because you never know who is transmitting it to you. So once this lockdown relaxation norms are in place and you have more movement, you do expect that the person who is harboring the virus himself doesn't know it, and he can spread it to people who are around. And people who are more than 60 years with cardiovascular illness and other comorbidities continue to be at higher risk. They continue to have more issues if they get COVID. What has India and the world done so far? It is flattening the curve, and we've heard it repeatedly. It is important for us to keep the curve within the limit of the health infrastructure. The red line which you see on the slide is the health capacity. We may have increased it slightly, but what happened in Italy was this particular curve with the big, tall, purple hill suddenly came up without the health system getting ready for it. So you had large number of cases all coming in at once with no space, no availability of infrastructure or the health personnel to cater to them. And that was exactly the problem. So flattening the curve continues to be relevant. And we know that the clinical course, most of them have an uncomplicated mild illness. Mild pneumonia is diagnosed when the person has fast breathing. Severe pneumonia, as we all know, is fever plus tachypnea, respiratory distress, or oxygen saturation less than 90%. And we all know about ARDS. ARDS is the one which is worsening the symptom, the happy hypoxia preceding ARDS, and the need for a ventilator to tide over the crisis of ARDS. These are two essential components of the severity of the illness. Now, one quick slide about these terms which you keep hearing. What is COVID hospital? What is COVID care center? Basically, those cases which are suspected of COVID have been triaged into those three categories which we now discussed: mild, moderate, and severe. Mild are those with upper respiratory infections, no breathlessness, fever, little cold, and cough. They are the majority, as you all know. Where are they planned to be treated or put up? These places are called as the COVID care centers. The second one is where there is some amount of tachypnea and there is lower oxygen saturation, but it reaches up to only 90%. They go to a dedicated COVID health center. A COVID care center is the hotel, lodges, hostels, stadiums, all of these which the government has kept ready just in case of need. The COVID health centers are the area hospitals, nursing homes, and some of the private health facilities where you have oxygen. You need oxygen for these cases because the saturations are coming down. So the stadiums and lodges and hotels don't have oxygen as a central oxygen, but these hospitals which have these capabilities will be COVID health centers. COVID hospitals are those that cater to severe cases of COVID, wherein the respiratory rate is higher and the oxygen saturation is less than 90. These are facilities with ICUs and round-the-clock nursing as well as doctor support. So these are called as the dedicated COVID hospitals. You might hear much more of it in the days to come, but now you know for sure what is a COVID hospital, what is a COVID care center. Now coming to the last part of my presentation, which is catering to the risk of infection. We all know that this risk of infection is for every one of us, and that everyone also includes you as health professionals. Infectious agent has a reservoir, a port of exit, a portal of entry into again the susceptible host, and this life cycle of the chain of infection will continue. Important for us to break even at least at one link completely, then we'll be able to break the chain of transmission. When you break this chain of transmission and seek help, not for every case would you have to start worrying. But when you have these symptoms, difficulty in breathing, persistent pain or pressure in the chest, mental confusion, and developing bluish discoloration, that is when you seek medical attention. And we all know these social distancing guidelines: maintaining physical distance, avoid frequent trips to the market, don't step out unnecessarily even if the norms are now relaxed, don't be too close to people. Recall this particular slide where I showed you the COVID particles and the spread. If you are within this particular distance and these particles start falling on you, that is when the problem starts. If you are maintaining physical distance, using a mask, and are able to avoid handshake, hugging, or coming close to the person, then you are taking maximum precautions. The virus can't just travel to you. You'll have to go pick it up with your hands and take it into yourself. Only then the virus will affect you. Now, last set of slides on the current status, and so far it's been all the depressing part of my presentation. Now the good part of the presentation. This is some infographics as of 2 days back. We see that India's COVID case mortality is almost one of the lowest in the world, despite the number of cases we have, but that number is primarily because of the population. So they looked at number of deaths per each 1 lakh of population, and India has only 0.2 deaths per lakh of population as compared to the global average. And the recovery rate has improved. Currently, 41% of them are able to recover. Active cases which are requiring critical care, 93% of them are getting normal care, those which are active, and only 0.45% needing a ventilator, about 5% in the ICU and requiring oxygen. The last slide of mine is just a ray of hope for us as we start. Manipur, as we know, is now free of COVID. We are all sitting in Telangana and hoping that we come to the same stage as Manipur. And there is hope for us. It's not the end of the road for a health professional who falls sick due to COVID and then has to stop his work. So this is a story of Reshma, a nurse. She was treating some of the COVID positive patients. She got the virus. She was positive. She was treated in an isolation ward. And few days back, she has even got discharged and has resumed her work after days of mandatory quarantine and following the principles of isolation. So there is hope for us. It is not the end of the world. We do understand it is just a virus. 80% of the time it's a mild illness. The propensity to spread and the actions which we have to take care if the person becomes positive, that is the concern. But there is no need for us to panic, no need for us to be in a state of fear. We always have to surround ourselves with good information, reliable sources, understand what it is about, understand what is the role of each one of us. And if we all contribute our own selves and our own responsibility is taken care, I think we should be able to do it. So that's all from my end. We'll be happy to take questions after the next session. I now request Dr. Nagendra to please take over.
Thank you, Dr. Sri Krishna, for setting up the stage very nicely. So before I going to start, I would request you to, please change the setting to live stream on a custom link. Then the live streaming will start. Okay.
Okay, Nagendra. I just noted that. I'll work on that. You may proceed.
Sure. Thank you so much. Yeah. Good afternoon, everyone. So as Dr. Sri Krishna has rightly mentioned, all the critical information with respect to COVID-19, now we will move on to what are these specific infection prevention and control strategies we should be implementing so as to be get save ourselves and the patients whom we are treating, and of course to reduce the community transmission. So to start with, we will talk about what is this IPC strategies and what are the standard precautions and what PPE need to be selected in which area of our care provision, and the procedure of donning and doffing we will see, and how we need to disinfect the surfaces around, and biomedical waste management we will be talking about in the next 15 minutes. So what is this infection prevention and control? This IPC is a scientific approach where we would be implementing a set of interventions so as to prevent the infection attack and also at the same time to curtail the infection spread from one person to another person. As Dr. Sri Krishna has mentioned, we need to break this chain of infection. We need to break that chain. Then only the transmission would be, halted from one person to other person. Why are we giving so much of importance to this IPC? Because we all know that this COVID-19 has one of the highest rate of transmissibility. We call it as R0. On average, every positive person is able to transmit this disease to almost 4 persons, which is very high for an infection which don't have any treatment or any vaccine. So this IPC strategies play an important role in containment of this virus. So as you have already seen, who is at risk of infection? Each and everyone who is getting with respect to in the areas where this COVID-19 is prevalent, everyone is at risk. So we already discussed this R naught is very high, so it is very much essential to ensure that everyone practices this IPC measures so as to reduce that infection. So what is more important? For any infection to spread, all links must be connected. Then only the one infection will transfer from one person to other person. So what are our motto should be? Our motto should be to break this chain. So we need to put all our efforts when and where it is possible to break this chain, then so as this transmission would be curtailed. So what are the basic standard precautions which need to be taken care? So irrespective of the suspect positive case, we need to maintain certain minimum preventive measures, such as using a mask always, and using a hand sanitizer, keeping aside of ourselves. And the other most important is always we need to risk assess in the area where we are working in. Do we need a minimal PPE or a certain next level of PPE? So based upon the area, if we are working in OPD, the certain level of PPE would be enough. If we are working in an ICU, because aerosol generating procedures would be done in ICU, so it is important that we need to have a much more higher level of PPE. So we need to have a risk assessment on an area where we are working in, and we need to have an appropriate PPE to that area. So what all the elements will come under standard precautions? We all know hand hygiene is one of the most important weapons against the containment of this virus. We have seen that through the droplet, this infection is getting transmitted. And so this duly following this hand hygiene can prevent up to 70% of the infection transmission can prevent. So it is single most important weapon which we need to be following very religiously by ourselves, and we need to encourage for our patients and the community as well. Next most important is respiratory hygiene. As we have seen that the droplets can transfer till 3 feet, so it is always important to maintain this respiratory hygiene, be it wearing a mask always, or coughing it onto our elbows when we don't have any mask or any hanky. So we will talk about that. And PPE, as per the risk, we have talked about this. Safe injection practices. We always know that body fluids are very high risk of transmission of this infection. So safe injection practices and safe handling and cleaning of disinfectant of all patient care equipment also plays an important role, because this virus can stay up to 2 to 5 days on a non-porous surfaces, on a plastic, steel. So it is always important to handle the belongings of a patient, of a COVID-19 positive patient, and very carefully. And as we discussed, disinfection of the surfaces, environmental cleaning is equally important. Safe handling and cleaning of soiled linen, as we said. So on the linen, almost there are evidences that almost 30 to 48 hours, almost up to 2 days on a porous surface, this virus can stay on. So it is very important to handle soiled linen also very carefully. And of course, waste management, all the PPE which we used, how are we going to dispose it? So we need to keep focus on that as well. So as we discussed, hand hygiene is a single most powerful method to prevent this transmission. We as a healthcare professional, we do everything with our hands. So being it checking and handling instruments, medications, providing the care, and doing all the assessment over the client. So it is always important to do either proper hand washing or using an alcohol-based hand rub very frequently, especially when we are handling the patients. So when to do that hand washing? These 5 moments has been given by WHO where for us, especially healthcare providers, need to be done mandatorily. When definitely before touching a patient, and before doing any aseptic procedure, or after doing an aseptic procedure, and after touching a patient's surroundings, and also after touching the patient. So these 5 moments are very much essential that this mandatorily we should be doing a hand wash. Now we can have a question that is that possible to do every time a hand wash? No, we can always prefer alcohol-based hand rub, which is much more convenient and much more faster than proper hand wash with a soap and water. So WHO has stated this as a gold standard where we can only 10 to 20 seconds doing an alcohol-based hand rub would be enough. But it is essential that it is important that we should be covering all the 6 areas of our hands so that no virus would be staying after doing our alcohol-based hand rub. If we are going for soap and water, we should be ensuring that at least 40 to 60 seconds need to be done and covering all the 6 areas of the hand. And not to forget, need to use a single-use towel, maybe a paper napkin, or a clean and dry towel. Again, if you are using a same towel again and again, that efficacy of the hand washing would be lost. So next important thing is respiratory hygiene or respiratory etiquette. So this, as we know, this is transferred through the droplets and attacking the respiratory systems of the person. So we need to, it is important that we need to ensure this respiratory hygiene. So while we are among the people, always turn head away and down and then cough. If essentially we should encourage the people that if it is possible to have a hanky before the coughing, or if they don't have a hanky or a paper napkin, then they should be able to cough onto their elbows so that they are not segregating or spreading all those droplets around the surfaces where they are standing on. And if they are using a hanky, paper tissue, immediately that need to be disposed into a covered dustbin, not an open dustbin. So these are all the PPE, various PPE which we use in our healthcare settings. And of course, that varies which all PPE we use on the place where we are working in. So what are the basic principles for using a PPE? That is must and should that we should clean our hands before wearing a PPE. And it is important that we should select a correct size with respect to N95. Correct fit and correct size is most important. And with respect to gloves also. So if the fitting of the mask is not good, even though you most advanced N95 mask you use, if the fitting is not good, that is as good as you are not wearing it. So it is important. We will see that how we should ensure a correct fit onto us, and always put on before the contact of the patient, before going into the patient care area, and we should remove immediately after the intended activity is done. And we should never reuse the PPE which are meant for single use, and we should be able to disinfect that reusable PPE. If at all it is a reusable, we should clean and disinfect, then only after following a proper protocol of disinfection, then only it should be used. So if it is damaged, immediately that should be removed, or if it is contaminated, immediately we should change it. And PPE should not be adjusted or touched. If we are seeing in our daily healthcare settings that some people are touching over the mask with the bare hands, and that doesn't serve the purpose. When we are wearing it, when we are touching everywhere, then it is as good as we are not wearing the PPE. So it is important that we should never touch the face while wearing the PPE. If there is a concern or breach of these practices, leave the patient care area and immediately doff all the PPE. And one more important thing, before the doffing of this PPE, it is always important that need to be doffed in a very particular method, because while doffing, we are more or less very clean and our hands are sterile. But when doffing, we are full of virus and our gloves are fully contaminated. So it is there is a high chance of getting infected. So we need to be patient when we are doffing, and we need to be carefully done so as to be ourselves safe from getting contact. So while we are dealing with a contact, we have seen in an earlier presentation that who is called as a contact. So a contact is a person who has came in a close contact with a COVID-19 positive patient, So there is high probable that he or she also might have got that infection. So if when we are dealing with them, it is important that we should be keeping them in a single room and encourage them and us to do a hand washing, and encourage them to have a mask always. Okay, and for us, gown and gloves should be mandatorily worn. So what are the other measures which need to be done? Equipment should be cleaned, disinfected and sterilized after checking the contact patients. Okay, so environmental cleaning, what need to be done? All the surfaces which have came contact with our contact patient, the person, that all surfaces need to be disinfected. How to disinfect? We can always use a commercial disinfectants or a local made bleaching solution, 0.5% bleaching solution we call it as. So how to prepare that? You just add 4 teaspoons into the 1 liter and mix it thoroughly, and then we can, that is a powerful disinfectant which can neutralize the virus wherever the surface it gets mobbed. So we can either use bleaching solution or a commercial disinfectant can be used to disinfect the surfaces. Then how to deal with droplets? So what precautions we need to be done, we need to be maintained. So definitely that particular patient, suspect or a contact need to be kept in a single room. If the single rooms are not available, then we need to ensure that the patient to patient distance should be at least 1 meter, as we have seen the maximum that droplets can travel to till 3 feet. So ensuring the distance more than that is always essential. And here we need to ensure to have a proper medical mask, a 3-layered medical mask, and eye protection, be it medical goggles or a face shield is mandatory, and gown is mandatory. And we should limit the movement of the patient who is there with us. So that person should be at one place. If transport or movement is required, there should be a place, where, a route where it should be earmarked before only, so that we should be minimizing the exposure to all the non-exposed or non-infected persons. Then what about this airborne precautions? This is most critical. We know that in a aerosol generating procedures, there is a risk of the generation of these airborne particles. So in a general setting, this disease is not an airborne generating disease. But when we are working in an ICU setting where we are doing a procedures of bronchoscopy, tracheal intubation, or pressure on a chest during cardiopulmonary resuscitation, there is a risk that these aerosols would be generated. So this is the place where we need to have utmost PPE with all possible available PPE need to be wear, which includes N95 mask, over that a surgical mask, and goggles, face shield, head cover, and all the overall, which hazmat suit we will call, and the shoe cover as well. So a complete protection is required when we are doing this aerosol generating procedures, essentially ICUs, when we are working in ICUs. This is the most important side which I was talking about. See, we are seeing so many politicians and in the TVs that so many people are wearing it, but nevertheless they are wearing only with one strap, which is as good as not wearing that. So it is highly essential that we as healthcare providers to wear it with a proper seal, just to ensure that the maximum protection we would be getting through N95. We all know N95 is the best protection from these minute particles which are which are aerosols. So what need to be done to check that seal? So we can do a positive seal check and also a negative seal check. For doing a positive seal check, we need to put up there's N95 and put up the straps and exhale sharply. When we exhale sharply, the positive pressure inside the respirator, we should not experience any leakage. So if any leakage is coming, immediately tighten the straps or adjust the seal. then repeat the step again to ensure that this respirator is sealed properly. Then what is the negative seal check? We need to inhale deeply. So if no leakage, that complete mask would get, cling on to your face, stitch to our face, which ensures that a vacuum is created, which ensures that the seal is properly maintained. So then we can be sure that we have properly wore that N95 mask. So please see these steps. Just put the N95 mask over onto your mouth and nose. Then take up the one step we will see in the video first, and the second one next, and ensure this positive and negative seal checks to ensure the correctness of the sealing. Now we will see just a short video how we need to don all the PPE.
How to safely put on personal protective equipment, or more commonly called PPE.
Can you hear? Dr. Sri Krishna, can you please confirm?
Yes. Audio is on, video is also on. Go ahead.
Thank you.
We will demonstrate one way to appropriately put on or don PPE. More than one donning method may be acceptable to your facility. It's important that you receive training, demonstrate competency, and practice your healthcare facility's donning procedure. First, identify and gather the proper PPE to don, including an appropriately fitted isolation gown, a NIOSH-approved N95 filtering facepiece respirator or higher level respiratory protection, or if a respirator is not available, a face mask, a face shield or goggles, and a pair of disposable patient examination gloves. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Put on the isolation gown. Tie all ties or snap all snaps. You may need assistance from another healthcare provider. Put on the N95 respirator. When using a respirator with a nose piece, fit it to your nose using both hands. Do not bend or tent the respirator. Extend the respirator under your chin, protecting both your mouth and nose. Pull the top strap over your head, placing it on the crown. Then pull the bottom strap over your head, placing it at the base of your neck. Lastly, perform a user seal check. Do this by using your hands to cover the surface of the respirator and gently exhale, checking that the facepiece bulges slightly. Then, while keeping your hands over the respirator, take in a quick, deep breath, checking that the facepiece collapses slightly. If air escapes through the edges, readjust the fit of your respirator and perform another user seal check. Do this each time you put the respirator on. If a respirator is not available, put on a face mask. Extend the face mask under your chin, protecting both your mouth and nose. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Next, put on a face shield or goggles. Once again, perform hand hygiene. Lastly, put on your gloves. Pull the gloves down so that they cover the wrist of the gown. You are now ready to enter the patient's room.
Hope you have got an idea of donning the PPE procedure, where the one conclusion point is the order of the procedure should be, we need to put on a gown first, of course hand washing before that, and after the gown, mask, and put an eye shield, and then go for the gloves. So if we ensure these steps, then that would be a most proper PPE donning procedure. Now we will see a doffing procedure, how to take it off.
How to safely take off personal competency in removing your PPE and practice your healthcare facility's doffing procedure. Remove and discard your gloves. Gloves can be removed using more than one technique. For the glove and glove technique, pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the gloves. For the beaking method, pinch the outside of the glove near the wrist. Using your finger, pull the glove inside out and over the fingers and thumb to form a beak. With the beaked hand, pinch the opposite glove at the wrist and pull downwards, turning the glove inside out. With the ungloved hand, pull the beaked glove off, touching only the inside of the glove. Next, remove your gown. Untie all ties or unsnap all snaps. Some gown ties can be broken rather than untied. In that instance, break the ties gently, avoiding a forceful movement. Reach up to the shoulders and carefully pull or roll the gown down and away from the body. Dispose of the used gown. You may now exit the patient's room. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Be sure to clean your wrists where the edge of the glove was located. Carefully remove the face shield or goggles by grabbing the strap and pulling upwards and away from your head. Do not touch the front of the face shield or goggles. Next, remove and discard the respirator or face mask. If you are wearing a respirator, remove the bottom strap by grabbing only the strap and bringing it carefully over your head. Grasp the top strap and bring it carefully over your head, and then pull the respirator away from your face without touching the front of the respirator. If you are wearing a face mask, carefully untie the straps or unhook them from your ears and pull the mask away from your face without touching the front of the mask. Lastly, once again, perform hand hygiene after removing the respirator or face mask. You have now completed the doffing procedure.
Hope you have taken note of this doffing procedure, which we have already mentioned that doffing is a most important just to ensure that we are safe from that infection. So it is important that need to be done a little more patiently and as per the procedure. So the order would be first we will be removing the gloves and then gown, and then we go for again hand wash, and after that we will remove this face shield and then mask, and at last we'll go for hand washing. So at last we will just have a word about how would we do this environmental cleaning disinfection. As we already discussed that it is very much essential that all the surfaces, this primarily transmits through the droplets. So it is very much essential that all the surfaces need to be disinfected very frequently. We are seeing that all the governments are doing their best to disinfect almost the streets very, very frequently, maybe, twice a day. Now that all the trains and buses have started, all the bus stand is getting, all the surfaces all the environment in the bus stand as getting disinfected through the disinfectants, which primarily used the bleaching solution. So we can use this local made 0.5% bleaching solution to disinfect our surfaces. Just that we need to have adequate bleaching powder with us, so that when required, it can be prepared and used as a powerful disinfectant, which effectively neutralizes the virus. And all the medical devices, especially the stat and the mobile phones, which are the single most source of infection. Now that in all the government hospitals, the healthcare providers are not expected to take their mobiles into their service areas. So it is important that to always disinfect all the devices, all the belongings while we are going to home, and when as and when it is required. So by this, we will conclude that infection prevention control is essential element for containment of this virus. And this is the single most weapon which need to be ensured for controlling this disease. And the key principles being hand hygiene, respiratory etiquette, and safe distancing is the key. So we need to ensure all this during our care provision. First, we need to protect ourselves and all the patients and community. Then, and triaging is most important in our healthcare settings. We need to be very specific that as soon as the admission comes, where the initial segregation we do, and where we will take the suspect, or where we take the normal patient. And nevertheless, we need to ensure that judicious way, rational use of PPE, just to ensure that a maximum benefit we would be getting from the PPE. And it is very much essential to pay attention while we are donning, and also especially when doffing this PPE. Thank you so much. This is all from my side. Let us fight this pandemic by breaking the chain.
Thank you, Dr. Nagendra. Thank you so much. Dr. Srikanth, would you want us to take up some questions now? There are some questions catering to the dental practice. I'll take those later, but a few questions we'd like to respond now. You want us to go ahead? Yeah. One of the very important update has been on hydroxychloroquine. So let me quickly take you through what has been the current guideline. And a lot of it has come from evidence. At the outset, we all need to understand this disease is 4 months old, not more than that. December 2019, 30th is when the first case at least got documented. And whatever evidence we have is all from that information, and it keeps changing. We can't keep telling ourselves this is final. And even Government of India will keep changing its stand, and also they'll try to make things easy for us. But we also need to quickly adapt. Let me take you through the earlier guidelines and again this one. So yes, I hope you all can see the slide PDF now. The first one was this. This is the advisory on hydroxychloroquine. This was released on, you can see the date here, it's 22nd of March. This was when we first got the advisory. At that time, what did ICMR and the Government of India tell us? Very strictly, it says that it will be catering only to the asymptomatic healthcare workers who are treating COVID and those contacts of laboratory confirmed COVID. This was the initial recommendation. What is the revised advisory which has come up 2 days back? And this supersedes the earlier advisory. So what has this said? They have done studies, understood what is requirement, and based on the current guidelines and information which is available, this will be the inclusion criteria. So the Joint Monitoring Group and NTF have recommended hydroxychloroquine as a prophylaxis in 3 categories. The third one is the same, the asymptomatic contacts of laboratory confirmed cases. So every contact of the house of those who are positive must get it, and they continue to get it. The second one was those asymptomatic frontline workers who have been deployed in containment zone, and the paramilitary or the police personnel who are involved in COVID-19. So this is the first time we are hearing that even the paramedical, medical, police who are deployed in the containment zone, this is not about everybody. Those in the containment zone, even if they are non-medical, they will get hydroxychloroquine. The first category is the new change. Earlier, we had seen that it was only if you were treating COVID positive. Now, as per the current recommendation again by Government of India, all asymptomatic health workers involved in containment and treatment of COVID-19 and asymptomatic healthcare workers working in non-COVID hospitals or non-COVID areas of COVID hospitals, which means literally every healthcare worker is covered. If you are in a COVID hospital, yes. If you are in a non-COVID area of even a COVID hospital, yes. So if you are a healthcare worker, asymptomatic, then it is recommended that you take hydroxychloroquine currently. Very important to know the contraindications also. It is contraindicated in case of retinopathy of prematurity, hypersensitivity, G6PD deficiency, and any existing cardiomyopathy or rhythm disturbances. These are very important contraindications for which we need to be better aware and try to avoid. So this, and specifically, no prophylaxis for children less than 15 years, no prophylaxis for those who are pregnant. The drug is not recommended. So this is about this. We will try to share this in detail, but I thought I'll just respond to that particular query.
Dr. Sri Krishnas, I am intervening here. I think, is it okay?
Yes, sir. Go ahead.
Yeah. I think first we would take many of the viewers are waiting for the questions because they would require more time. Probably a lot of information will be covered. However, this information is available for them.
Yes. Sir, I'll go to the next question. There were a couple of questions which had come up in the question and answer. One was on how do we manage aerosols? See, the aerosol generation is dependent upon the type of procedure. Intubations, any form of pulmonary procedures, foreign body removals, or anything that generates aerosol requires the maximum PPE as recommended for such procedure. That includes the mask, the shield, the gown, gloves, and all the PPE which is recommended. You would be able to manage only with the PPE. There is no specific recommendation or change to the infrastructure which has been recommended as yet. So you continue to work in the same premises and the same place. It is just that the PPE has to be meticulous and without even a single chance of leak or lack of compliance. That is the most important part. The question was on Manipur.
Dr.
Yes, sir, go ahead.
That is incomplete. For the dental point of view, many of them would like to know the aerosol procedure.
Yes, sir.
Yeah, how to be addressed them.
Dr. Sri Krishna, one second.
Yeah.
Is it possible to get all the participants on the screen?
Yes, sir. Yeah, they are all listening to us. Yes.
For just a few minutes, because what is happening is the numbers are going up and down. The people don't know whether they are in or not.
Sir, for a few minutes, the concept of this webinar would be such. We won't be able to have them all in, but each one of them is able to see us and also respond back.
Yeah.
And
okay. Aerosol again.
Yeah. Yes, sir. Go ahead.
Yeah. The query is from you. Can you read out the participants who has put that query?
Yeah. So the aerosol question is from. I think the attendee's name is not reflected here.
Basically, many of the participants or the dental surgeons are concerned about the aerosol procedures, and today's apprehension in dentistry is one of the important reasons. Let me clarify to every participant and the dental surgeon who is sitting here. It is aerosol is not going to prevent us from practicing dentistry, and we have a very safe mode of working. And dentistry has seen many challenges. Now, today, you are well equipped to manage this kind of aerosol procedures, particularly when you are working in the clinical environment, apart from the guidelines which are given by the Government of India, which you have already mentioned on the screen and already our people are aware. The aerosols are created, particularly when working on with a aerator handpiece, or any of the procedures which you are carrying out on the chair side, the aerosol is created. How to control them is an important area. They are worried. Majority of the cases, I would recommend, if they are able to do, apply a rubber dam. Rubber dam application will help most of the cases, because one is, even if the patient develops a gag reflex or a cough, patient himself is protected as well as the operator is protected, assistant is protected, and also the auxiliary staff are protected. Particularly if you want to do the procedure with high-speed handpiece aerotor, because aerotor is the one which is going to create aerosol. And already you are with PPE equipment and you are well protected with the mask, N95 mask. On top of that, you are using a surgical mask. So probably that will definitely help. And we would strongly recommend the application of rubber dam to come out of many aerosol procedures. And also, particularly this period of acute COVID-19 period, unless it is an emergency, like an excess opening of a root canal treatment, and any of the procedures where you are not able to cut the tooth with the low speed handpieces, that is micromotor handpiece. Next is high speed, high torque handpieces are available now without the air pressure. If you are not able to do that, then only go to the aerotor handpiece, which is high speed equipment, which has more potential or tendency for producing the aerosol. And another important thing when during the procedures is, if the crown cuttings are required at this point of time, probably wait and see. Unless it is mandatory, we are not going to do the crown cutting procedures immediately, where we can postpone and wait for the right procedures or right facilities available. We can do the crown cutting later. For that, an alternative could be, sometimes you just give an onlay and leave it instead of cutting the entire tooth, because rubber dam is there. You may not be able to reach the cervical areas to cut the tooth. That is what is recommended if you go through many of the procedures to manage the aerosol in the patient mouth. Then apart from that, Dr. Srikanth has very well, Sri Krishna has very well mentioned about how to maintain the clinic for the aerosol procedures. You have entire list. Like every clinic has its own guidelines, and every dentist, I think we need not give them again and again the same thing, because they have undergone many of these webinars. However, that Srikanth also has a point from the practitioner's point of view, he can put it.
I think Dr. Jagdishwar Rao sir has a point. Can you unmute him, please? Dr. Jagdishwar Rao sir.
Yes, sir, he can unmute himself. Nevertheless, I am unmuting him. Yeah, okay. Dr. Jagdish, go ahead.
Hello.
Yes, yes. Hello. Please go ahead, sir. Please go ahead.
Dr. Karnakar says about regarding opening of the RCT or something. But what about oral prophylaxis? When we are going for oral prophylaxis, we cannot use the rubber dam. So by that time, what precautions we need to do? Why? Because in the government sector, we need to do more number of oral prophylaxis cases in the government dental college. So how to protect or how to avoid the aerosols in that condition?
Yeah, actually, Dr. Jagdish has brought another valid point, which every practitioner has to treat a case. In these cases, basic protocol, like starting from, as again, we have to go back to the case appointment. The appointments are not given, that is walk-in. Most of the appointments should be given online. Number two, your receptionist should be well trained, or put an online appointment sheet where they should give the case history of any of these COVID features, or any of the history of patient which he or she is having manifestations which are avoidable for visiting the dental clinic. Once the patient comes, then the regular management of the patients, that is like you give your sanitizer, you give your other possible measures. Once the patient comes, you are going to put the chlorhexidine mouthwash, and also the sodium hypochlorite, which is also 0.5%, can be given, and they rinse it and then enter. To some extent, that is already taken care once the patient is inside. And entire handling procedure also should be trained by your assistants who are working for us in the clinic, should be knowing what protocols should be followed. And what I feel, the oral prophylaxis is one which doesn't going to be very, very complicated if you are going to treat with all precautions in the clinical side.
Shall we take next questions from any of the attendees?
Yeah, some of the other questions, and if I can ask Dr. Jagdishwar and also Karnakar to respond to some of these questions, I'll put them up because I know that these are not covered in some of the presentations, sir. Now, to Dr. Karnakar, all masks are having some form of leakage rate. So which mask do you advise, especially for the dentists?
And in the masks, WHO and also our Government of India has recommended N95 masks are trustworthy, but they are saying don't use only N95 mask alone. On top of N95 mask, you use a surgical mask. So that it is well protected, and the protection mode is very, very important, how well you are applying it to that. Apart from that, you are also going to have a face shield. So the assurance for the N95 mask is many studies have shown that 95-96%, but 100% safety is not mentioned. Like any other procedure, if you are doing it, there is some amount of clinical risk. That factor in the procedure, what procedure you are going to treat in the clinic is important. All the simple procedures may not have any such kind of a risk that you should not be worried about quality of N95 mask.
That was a very good point, sir. One more thing we wanted to discuss. We ourselves from the IDA, we had a lot of conducted a lot of webinars in the last lockdown period. We wanted to divide the patients into categories. The first category was only consultations based, where we just diagnose and then post the case for the treatment. Then you divide the case into two, that is aerosol generating cases and non-aerosol generating cases. Depending on that, you keep your staff that day, the equipment, the PP ready, whether you're doing an aerosol generating procedure or a non-aerosol generating procedure. Over to you, Dr. Sri Krishna.
Yes, sir. Let me ask Dr. Nagendra a lot of questions on the PPE. Nagendra, let me put up all the questions for a quick answer from you. Is it feasible to wear the PPE kit for each patient? And can you use the N95 mask again? Tell us more about this concept of a reusable PPE and how safe it is for us to use the same again.
Yeah, with respect to reusing of N95 mask, as we can see the protocol on AIMS, which given maybe 3 weeks before that, each doctor in the AIMS has been provided 5 N95 masks, where they are encouraged to keep it in a 5 different pouches. So immediately after working their duties, so they are requested to put in their pouch, and then they are used after 5 days. So once all 5 N95 masks are used, then after the 6th day, they are encouraged to use this. So without doing anything, like there is no disinfection, it is just that putting in a well ventilated pouch. Okay,
like
so that
bag.
Yes, correct. Yes. So that is with respect to N95, which AIMS is also advocating for their own staff, which we can also do. And in the government hospital also, it is being encouraged in many COVID hospitals. And with respect to overalls, I don't see as of now in our Andhra Pradesh setup, the reusable overalls have been distributed, because as of now, everything is disposable. So there are no as such reusable overalls as of now.
Yeah, you're right, Dr. Nagendra. Here, I'd like to tell you one point. The reusable masks are the normal 3-ply masks. Okay, they are having the same design as an N95 or any of those same round pattern design, which have that much of what you call that aerosol obstructing.
Yes.
Okay. So when it comes to the N95, it is very important, because availability of the mask is one more important point, and the cost, that we follow the 5-day rule. The 5-day rule.
True. Absolutely.
Yeah, so that's about the PPE. I think what we'll do is we'll go ahead with the session on the dental, because many questions on infrastructure. Do we do it in the open? How do you change your dental space? So let me take up the first session, and I request the session on risk triaging and infrastructure. I'll put up these slides, and Dr. Jagdishwar, I think, for this session. Sir, shall I start? I'll put up the slides and you can go ahead.
Yes, sir.
Yeah, so I'm sharing my screen, and Here we are, sir. Please go ahead.
Hello. Hello.
Hello.
Yeah, Doctor.
Dr. Jagdishwar, or who's taking this session, sir?
Yeah, Dr. Jagdish.
Anybody, both Dr. Jagdishwar and Dr. Karnakar will be taking this session.
Yeah. Please, one of you can go ahead. I'll go through the slides.
No?
Yeah. Sir, shall I start?
Yes.
Yeah, please. So I'm now coming to the session on Government of India Guidelines on dental practice. I'm just putting up what is in the guidelines, and then we'll be happy to discuss, share feedback, share our experiences. Let me quickly take you through what's written in the 10-page guideline. So in the current COVID-19 pandemic, dentists, auxiliaries, as well as patients undergoing dental procedures are at a high risk of cross-infection. Most dental procedures require close contact with the patient's oral cavity. We all know saliva is very rich in COVID-19. And many patients who are asymptomatic may be carriers. So all patients visiting a dental office must be treated with due precautions. And who are all covered in these guidelines? Healthcare workers who are required to attend the dental ailments from remote locations, working in PHC till multi-specialty clinics. All of them are covered in this particular guidelines. Zones and dental clinics will remain closed in the containment zone, but they can continue to provide tele-triage service. Patients in this particular zone can seek an ambulance service to go to the nearby COVID dental facility. So all dental clinics shall remain closed in the containment zone. What about the red zone? Emergency and dental procedures can be performed. In the orange and green zone, the dental clinics will function to provide dental consultations. Dental operations, however, should be restricted to emergency and urgent treatment procedures only. All routine and elective procedures should be deferred for a later review until any new guidelines are issued. And due to the risk associated with examination of the oral cavity, oral cancer screening under the National Cancer Screening Program should also be deferred. Coming to the list of dental procedures for an asymptomatic COVID person, what they have done is they have listed it out as the clinical condition and the, for example, fast spreading infection of the facial spaces or Ludwig angina, acute cellulitis of dental origin, acute trismus, uncontrolled bleeding, trauma involving the face, all these are made as very high risk. Severe uncontrolled dental pain not responding to a routine measure and radiography are termed as high risk. In children, it's again the same. I don't want to go through the list. This is a big list, and I'm sure IDEA will be sharing these lists with you. The clinical condition of the dental origin, which requires a priority care but does not increase the patient's death risk, are considered as urgent. Those that increase the patient's death risk are considered as emergency. There is clear distinction between what is urgent and what is emergent. Now, what are the modifications which are suggested for a dental clinic setup? So the dental operatories should gear themselves for readiness in 3 phases. The first point is on testing for COVID-19 before resuming work in the clinics. And I quote exactly what is given in the guidelines. Healthcare workers who are asymptomatic and do not fall under the category of being exposed to the coronavirus infection are not required to undergo a test before resuming work in the clinics. Second point on hydroxychloroquine prophylaxis. As per the advisory, all those who are involved in the care are advised to take HCQ prophylaxis after a medical consultation. It's a prescription drug, so make sure it is given on the prescription. What are the modifications which are necessary for ventilation and air quality? We need to maintain air circulation with natural air through a frequent opening of windows and using an independent exhaust blower to extract the room air into the atmosphere. Avoid the use of a ceiling fan while performing the procedure. Place a table fan behind the operator. Let the airflow be towards the patient, not towards the doctor from the patient. A strong exhaust fan need to be located to create a unidirectional flow away from the patient. The window air condition system or the split AC should be frequently serviced. Filter should be frequently cleaned and should be equipped with HEPA filter and UV light. In centralized AC buildings on a recirculatory system, blocking of the return air vents in the patient area will temporarily stop air circulation, provided AHU will have provision to receive adequate amount of circulation. Next, coming to the clinic entrance, reception and waiting, we need to display visual alerts at the entrance of the facility and in strategic areas about respiratory hygiene, cough etiquette, social distancing, install a glass or a plastic barrier, ensure availability of adequate 3-layer masks, distance between the waiting chairs at least 1 meter apart, all the areas to be free of fomites, magazines, toys, remotes, anything that can gather the COVID particle, let it not be around unnecessarily. Preferred contactless, cashless payment, and a bin with a lid to be available at the triage where patients can discard the used paper tissues. Now, there are other rooms as well which are suggested. You need a changing room to be available for the staff and all workers to wear the surgical top and pajama and clinic shoes. A dedicated area needs to be identified for PPE donning and doffing. This is as per protocol. A dedicated area for sterilization and specifications for washrooms as well. And modifications required for a clinic setup, equipment and instrumentation have been given. Fumigation systems, high volume extraoral suction, indoor air cleaning system, dental chair water line should be equipped with retraction valves, used hand pieces with anti-retraction valves only, chemicals, appropriate PPE, all these need to be in place. So that's the list of what is the infrastructure modification which is required for a dental clinic setup. Now let me take you through other segment, the other half of the guidelines, which is on the practices, and this will be completing the second half. This relates to the protocols and management. I'll be sharing the screen. Yes. So this is the protocols and management guidelines. The first important thing is to have training. We need to train administrative personnel working in the reception of patients on hand hygiene, social distancing, educate all healthcare workers on proper selection and use of PPE. Staff should rotate more frequently, preferably should avoid long work hours. All staff and dentists must use surgical attire in the dental office. Avoid all personal clothing. The COVID-19 virus can potentially survive in the environment for several hours or days. So premises and areas which are potentially contaminated with the virus to be cleaned before their use. Now, very clearly it is given how to disinfect the dental clinic. For the floors, it is a 2-step cleaning procedure. What you need is a detergent and a freshly prepared 1% sodium hypochlorite. The contact time of the detergent and the sodium hypochlorite is for a contact of 10 minutes. You mop the floor starting from the far corner towards the door. You can do it after any patient or major splash, or clean the floor every 2 hours. That is the recommendation. Rest of the surfaces, again use the same 1% freshly prepared sodium hypochlorite solution, contact time of 10 minutes. Damp dusting should be done in straight lines that overlap one another. This frequency is suggested before starting daily work, after every procedure, and after finishing work. The rest of the surfaces. What about the delicate electronic equipment? For this, 60 to 90% alcohol-based spirit or hand rub, swab before each patient contact. Teleconsultation is strongly suggested. It is encouraged to be the first point of contact between the patient and the dentist. Current medical history and past history, particularly pertaining to symptoms of severe acute respiratory illness or all symptomatic influenza-like illness, must be analyzed. Any positive response to either of the questions, you should postpone the surgery or the consult for 3 weeks. And all of them need to be told to download Arogya Setu app. Dental history and remote triaging. Obtain M-Oral Health, which is mobile phone-based oral health screening about the dental history, and try to manage problem with advice and analgesics. Clinics can evolve a web-based form which can also include a consent form. comprehend the dental treatment according to the urgency of the required treatment and the risk and benefit associated with each treatment. Only pre-appointed patients to be entertained in the clinic whose history, problems, and procedures are already identified to some extent through the telephone or web-based systems. So what can patients do before they arrive at the clinic? They need to minimize or eliminate the accessories, the watch, hand and body jewelry, bags. Try to have it bare minimum. Use their own washrooms at home. Don't unnecessarily use it at the clinic. Have a mouthwash rinse with 10 ml of 0.5 solution of PBP1 solution. Distribute throughout the oral cavity for 30 seconds. Gently gargle at the back of the throat and then spit it out. Wear a face mask during transport and also before entry. Check the temperature. Sign on the patient's consent and declaration form and maintain social distance. These are the recommendations for the patients before they arrive at the clinic. After they arrive, what are the protocols for handling the patients? For appointments that do not result in aerosols and need examination, wear a triple layer surgical mask and protective eyewear or face shield and gloves. Wear N95 mask plus protective eyewear or face shields and gloves along with the coverall only for high risk and very high risk procedures. That is why we put up that initial presentation on what is the modality and what is the intervention and the risk strategy, risk categorization. To increase the shelf life of N95 masks, you may cover them with a surgical mask as we had just discussed and discard only the surgical mask after use. That way you will be able to preserve the N95 mask for a longer period. When examining patients with moderate risk, the treating doctor will require all the PPE as high risk, except that the coveralls can be substituted with surgical gowns. Practice non-aerosol generating procedures as much as possible. Use of a rubber dam is encouraged, as the experts had just discussed, and the four-handed technique is beneficial for controlling the infection. Disinfection protocol. Patient turnaround and disinfection protocol. After the patient leaves the treatment room, the assistant will collect all the hand instruments immediately, rinse them in running water to remove organic matter as per standard sterilization protocol. All 3-in-1 syringes, water outlets, handpiece water pipelines should be flushed with the disinfected solution for 30 to 40 seconds. Remove the water containers and wash them thoroughly and disinfect with 1% sodium hypochlorite using a clean cotton or a gauze piece, and then fill with fresh 0.01% sodium hypochlorite solution and attach back to the dental chair. Then disinfect the dental chair along with all the auxiliary parts within 3 feet of distance using 1% sodium hypochlorite and clean and sterilized cotton gauze piece using inner to outer surface approach, and then leave it for drying. New cotton or gauze piece should be used for every surface. Don't use the same one for all of them. Hand pieces should be cleaned using a hand piece cleaning solution to remove the debris, followed by packing. Impressions will be thoroughly disinfected before pouring or sending to the lab. Remove visible pollutants completely before disinfection. Mop the floor with 1% sodium hypochlorite solution through separate mops for the clinical area, following unidirectional mopping technique from inner to outer area. So this is the disinfection protocol. The last set of protocols are related to clinic closure and what we need to do after we reach home. For clinic closure, fogging, it is used as a no-touch surface disinfection and not for disinfection of air after a large area has been contaminated. Commercially available agents are hydrogen peroxide, 11% weight by volume solution. A 20% working solution should be prepared, and the volume of working solution required for fogging is about 1000 ml per 1000 cube feet. After the procedure is completed in the operatory, exit the room, close the operatory for half an hour for the aerosols or droplets to settle down, and perform the 2-step surface cleaning followed by fogging. The fogging time is usually 45 minutes, followed by contact time or dwell time of 1 hour. After that, the room can be opened, fans can be switched on for aeration, wet surfaces can be dried or cleaned using a sterile cloth. Next, protocol for healthcare workers on reaching home. On the way back home, follow all precautions, and on return, follow the removal of shoes, change of clothes, have a wash, disinfect your mobile wristwatch, etc. What's the patient discharge protocol? The patient drape will be removed by the assistant and the patient is asked to perform hand wash and guided out of the clinic towards reception. The procedures and prescription is recorded only after doffing the PPE. Patient also to perform hand hygiene and to be provided with instructions. When the health worker reaches home, perform all the precautions as we just discussed. Phase 3 patient follow-up and review. Patient should be contacted telephonically after 24 hours and also after a week to know if he has developed any symptoms that should warn the dental staff. He should be advised to inform back if there are any adverse symptoms. And healthcare workers who are required to attend dental emergent ailments in remote locations in the government sector should provide advice and analgesics and advise and refer the patient to a dental surgeon for further management. So this is all, which is an extract from the Government of India guidelines. I now stop here and I'll request the panelists to take up questions. Nagendra, if you could please help in the questions so far.
Yeah.
Yes, sir, go ahead.
Dr. Sri Krishna, the
Yes.
guides have been elaborate and given a lot of things, but like we discussed, for every guideline, there's so many deviations, so many newer things will be coming on. So if
Yes,
you take the questions in the Q&A session, a lot of 30 questions are there right now. If we start, I think fresh, I don't know whether we'll be having time.
So we'll have quick answers. I mean, the experts are with you in the panelists, Dr. Karnakar, Dr. Jagdish, as quickly and as precisely you can answer even the toughest questions.
Dr. Srikanth and Dr. Sri Krishna, many of them are similar questions. Some can be joined.
Yes.
Yeah,
Sir, please go ahead. Dr. Srikanth, in fact,
I will take the questions. I will take the
questions
and I will post it. So
please go ahead.
Question number 1. Is it feasible for wearing PPE kit for every patient in dental setup? That depends on whether the dental setup is a private or college. So Dr. Jagdishwara sir, Dr. Karnakar, is it feasible for wearing the PPE kit? Can you see the questions here?
Yeah, Dr. Jagdish, are you taking that?
Okay, then what?
When it is required, we need to do it, no?
Yes.
Why? Because if it is required, definitely we need to change the, for every patient, we need to change the PPE kit.
Yes, and like we discussed earlier, all the patients will be divided into 3 categories. The first category is only checking up. What you call?
Srikanth, the question is for the institution. Usually, the facility should be made in such a way that the OPD is one area where you see only the patient is screened. Before seeing the patient, there will be patient is coming with the field format. And initially, patient is examined without any PPE kit, only with the well-protected shield and the N95 mask. Then when you are going to the next level of screening the mouth and taking it for any procedure, the other category of doctors are waiting with the PPE kits. So that means every patient may not be with the PPE kit. The patients are initially attended with the initial personal protection kits of the face. Then having a proper surgical gown where patient can full day the doctor or operator is available in the OPD, and the gown will go for autoclaving regularly. And the second category, when you are touching the patient and treating them in a separate phase, every patient needs to be attended with a personal protection kit.
Okay, Sri Krishna, how do we say that this question is answered?
That's all from our end, sir. I think no further information on that. Please go ahead with the remaining questions.
Yes.
Yeah. What is the best way to disinfect reusable PPE? So
what is that question, Srikanth?
What is the best way to disinfect reusable PPE? Now this thing about reusable PPE has come, and some of the manufacturers are giving that autoclavable, and what you call you can use it for 30 days. It is not permanently reusable. At the max 30 days is what they are saying. So sometimes another manufacturer comes up with a newer specification. He would say 2 months. He would say 3 months. But right now only 1 month is available. But more like you said, the specs of the PPEs are changing by the hour. Every day you will take a WhatsApp message or an email or anything, a new spec is coming. So Dr. Jagdishwar, Dr. Karnakar sir, in this matter.
Repeat the question, please.
what's the best way to disinfect a reusable PPE? Then how frequently should we take HCQ? If taken in April, how long will it be effective?
Sir, there is no guidance on reusing or repeating the HCQ as of now.
Absolutely. Already the first part of the question has answered about the PPEs, how to manage. Whether you are using a PPE kit or not using, there is nothing like reusable PPE kit which is mentioned in the literature.
Yes,
then the next question
is about
reuse. Yes, sir.
Reuse of N95 masks we just discussed.
I think there is another question which I have read on the screen about the clinic management. Yes. Somebody has come in the previous questionnaire about the private practitioners that in the clinic protocols. And many areas where we have missed out about the HEPA filters. HEPA filter will definitely help because this is high efficiency protective air. Okay. The particular air, high efficiency particular air. So this particular thing, usually HEPA filter, if you are having a pedestal fan having on one side and the other side HEPA filter, and you have an exhaust, the air to vent it out. Probably that will give a very good clinical environment, and also how it particulates the aerosol is very, very important when you are doing with the handpiece or any of those areas. The particulates are 0.50 particulates are automatically, the droplets are falling down. They need not be taken care. The size thinner than that are available in the air. They needs to be treated. For that, you are doing these procedures which are used basically to maintain the clinic with sodium hypochlorite 5% and then wait for 20 minutes to 2 hours where the particular microorganism or virus is available in the area.
Okay. Now,
in between, whenever the major procedure is carried out, to continue the next case, minimum is 20 minutes, maximum is 2 hours according to the type of procedure you are carrying out.
Yes. Now we have one more question. What is the protocol for oral examination, intraoral examination? What is the protocol for oral examination? Intraoral examination is contradicted. Some doctors refuse to see intraorally. Risk of sudden cough, sneeze anticipated. They see through a glass partition. If this is the case, we shouldn't be seeing any patient for any.
Okay. Shrikant, that is, you brief that question. It is in the way when the patient comes, how you are receiving and how you are sending it back. You can answer that.
Yes. See, like we discussed earlier, see, if you are wearing PPEs and if you are distributing the case in such a way that we are only examining, when you're only examining the case and posting it for whether an aerosol-based procedure or a non-aerosol-based procedure, then that will be the main thing that answers the question.
And also the cross-contamination of the case, particularly in the COVID cases, what the literature shows, some of the British dental journals have mentioned, patient not wearing a mask and doctor wearing a mask, the cross-contamination possibility is 70%. Both wearing a mask and the transfer percentage is 10%. And all the auxiliaries and the doctor, as well as the patient wearing the mask, the percentage is of transmission is 5%.
Yes,
that's
5%.
What the literature shows. So that means how well protected you are. And starting from the beginning, which already those slides have shown, which I don't want to repeat, how you are entering the clinic after sanitizing and how you are being treated in the reception and what kind of a protection you are having, including your payment mission, that is the credit card or debit card you are swiping, that mission also needs a protection which is being mentioned with a sheet, and every case you will have to change that sheet on the mission because they use the buttons. Yes, starting from there, everything starts. And also the distance between the chairs. If you are having more than one chair in a dental clinic, minimum 12 feet distance needs to be maintained to avoid the contamination of the one patient to other patient when you are treating it. Particularly when you are treating any aerosol procedure, it is better you attend one case at a time in the environment than attending 2 cases in the same sitting.
Yes.
Only 2 chairs in a clinic minimum will help to maintain more sterilization procedure easily, because one case you treat and next case after half an hour you can treat in the other chair, so that this chair is prepared for your procedure by your assistant. So most of the practitioners, anyway, it may not be possible everyone to have that kind of a space or 2 chairs. You have to wait for longer period. One thing we all should understand, that we are not running away from COVID, and this is manageable to run a dental chair with our routine dental treatment procedures. Only thing is we have to adjust and change from what you are doing earlier. You have to have more organized working in the dental clinic because the protocols are changed and they are more strict. So all of us should understand that we are not having any issue in attending the dental clinics. We should attend the dental clinics. We should treat, maintain the discipline of the protocols so that we are not landing up in some problem later because of the patient's mistake or because of our assistant's mistake or because you are not taken care of the existing environment. So I am very sure that all our dental surgeons are very much equipped with the knowledge and very much equipped with the clinical environment. It's only just the first few days to getting acquainted to the new environment and starting their work. Let us all see that our dental surgeons are going with full confidence to work and resume their work with more confidence. With all these webinars and all that, now they have enough. Now it requires to go to the clinics and start working on the patient. Naturally, when you start driving only, you will know the problem of the car. Same thing, you start working in the new environment, we will overcome that. There is nothing that we cannot treat the case.
Yes. Dr. Srikanth, I'll just take a break and just answer a couple of questions which are general so that I'll again leave you with the dental specific questions.
Yeah, we have just 7 more minutes, Dr. Sri Krishna. And,
we've got some time, sir. Not a concern, but I'd just like to finish in a minute, not more.
There's one
Disinfectant
question.
tunnels.
Sorry, there's one question.
Yes,
WHO says no foggers disinfectors. Government of India says yes for it. What to follow?
Government of India. No doubt.
Yeah, right.
Government of India. Yeah. Whatever Government of India says, as of now, dated, please follow it. I'll quickly respond to the remaining. Now, mandatory to take HCQ prophylaxis. Now, please take it if you have not. You've seen the guidelines. How effective are disinfectant tunnels? Answer, not effective. Proven. ICMR and even government have issued specific orders saying they have decreased the emphasis on other disinfectants and they are not useful. Spraying alcohol on the body does not help. Very interesting question on if saliva has got so much viral load, why are you putting it nasopharyngeal swab? The answer is, though saliva has, it is not as if you can spit out and then you can test for the virus in that. The reason is that this is a very delicate virus and it's been found that the yield is very poor, though it is present. So it quickly gets destroyed in settings for lab evaluation. Therefore, you need to take a deeper sample. So the nasopharyngeal sampling is the correct way. Saliva, though it has the virus, it will not be viable. Probably they found a link because of the gastric secretions being acidic. And we know that this virus is a very sensitive virus. What do you do if you get a person with fever and dental pain in your lab? Now, ideally keep a line list. And I'm sure Telangana government has instructed probably on Tuesday or Wednesday, you will get it from your regional SPHO as well. You will be asked to have a line list of all patients with history of fever, even history of fever. And then apparently this list has to be communicated to the local DMHO's representative, could be the PHC medical officer or SPHO. This needs to be kept. Please ensure you have a separate list of people who have documented fever, which you have seen in your hospital. Dr. Srikanth, over to you to take up the other questions related to the dental practice.
Yes. So now there are some more questions asking about the 7th and 8th slide that can be shared later. I think
I'll share it, sir. Go ahead, and we have time. You can take as much time. Of course, we'd like to finish it with full details. No constraint on the time. The time can be extended. Go ahead.
As per the Government of India guidelines, it's given that 11% what you call weight by volume of hydrogen peroxide, which is commercially available, has to be made to 20% working solutions in foggers. What does it mean and how to do it? Then in case.
Dr. Nagendra, any idea on this? Because I'll have to check and come back. Probably it's down to the weight by volume strength. So you'll have to mix it again.
So let's keep it.
We'll keep it. We'll get back on this later.
We'll get back. So
Dr. Srikanth, many of them are having how to maintain the clinic. That has a query.
Yes, I think there's one more question.
So earlier we were calling it as a fumigation. That concept slowly is withdrawn now. Fumigation is when you are using formaldehyde. That is left to the surgical area. Still, they may use it in theaters. But in our routine clinics, we should be sticking to the fogging. Fogging has what Dr. Sri Krishna has explained in the clinic. that composition and concentration of the liquids according to the clinic size can be used over sodium epichlorites and rest of the liquids.
Yeah.
Hydrogen peroxide, as per the manufacturers, the fogging machine manufacturers.
Yes.
But fogging machines are
yes.
Relatively advisable for our safety.
Yes. And this question is already
because you can now, as we are all aware that we are withdrawing air conditioners, or we better don't work with air conditioner, only a ceiling fan, but a fogging machine will definitely do world of good to the working environment.
Yes. Then in case of emergency access opening in children, where they do not cooperate for rubber dam, what are other safety measures needs to be taken apart from pre-procedure rinsing and complete PPE? I think what do you say about this, Dr. Jagdish Rao sir? In case of emergency in children's, when where they do not cooperate. And there is also one more question. This is exclusive for a child pediatric dentistry.
Sir, is there pediatrician can answer for us?
Yes, yes.
Yes, sir.
Dr. Srikanth, sir.
Yeah.
Sri Krishna, sir.
So this is in case of emergency access opening in children, sir. That is where they do not cooperate for rubber dam, and what other safety measures to be taken up apart from pre-procedure rinsing and complete PPE. I think in children, I think what we have to follow, come back to the main guidelines. We have to avoid any of these surgical procedures. Just keep it to what you call non-elective procedures. But in case of emergency, like how they have told in this question, how to handle it, then we have to follow the entire PP kit, maybe without what you call the rubber dam, use all the PP kit for the assistant and do the procedure. And try to use a micro motor, that is a non-aerosol generating motor. You're getting these new micro motors, which are non-aerosol generating motors. That is the only best way to start do the procedure. Then the Government of India has declared a health insurance scheme for all doctors. Is there any framework in place for us to access the scheme? Will there be an initiative from ID at state level to enroll all this? I think this question, in this question, what I would like to say is that now in most of the health insurance, there is this part, this COVID also is carrying the insurance is there in the COVID. So I think the idea need not come out with any special scheme for this. This is already there in now most of the health scheme. You can check with your health insurer. I think that is about it.
There is a question from Dr. Abraham.
Okay.
Satish. That
okay.
is on the management of multiple cases and the institutional setup.
Okay.
For most of the institutions currently, at least next couple of months, I sincerely feel we should stick on to the elective procedures or OPD and managing the emergency services only, Dr. Satish. As you know, we can create an environment in a bigger departments, each department having 30, 40 chairs of undergraduate and 15, 20 chairs of postgraduate program. Maintaining that particular area is still $1,000 question, how well we would be able to maintain with the sterile environment. And however, the patients who are coming such magnitude, the case history needs to be thoroughly evaluated. So probably most of the institutions may not be able to, are geared up for that kind of a big OPD initially for treatment procedures. But the routine OPD can be carried out with our regular measures, whatever we were talking about, the PPE kits, N95 masks, and the HEPA filters, etc., etc.
Yeah, then what about single room clinics where we are not able to provide separate donning and doffing areas, exhaust fans, etc.? So here, if you see, if you just take a cab, a small Ola cab, the driver himself has separated him from the thing. So if it is a single room clinic, you should make it in such a way that you will have to have a curtain or a polythene curtain or a plastic curtain separating these areas, and you even have these patient working areas, cubicles, small cubicles where you can put your hand and do the because we are discussing, everything need not be multi room clinics. Now single room clinics are also important, and this is how you have to manage. What do you say, Dr. Jagdishwar Saab?
Yes, yes.
Single room clinics.
Single room clinics for sterilization is easy than compare with the multiple chair.
Yes, you're right. Yes,
this multiple chair problem will be occur in the hospital setup.
Yes.
In the college setup.
Yes.
In the college setup, we are thinking about that only. Why? Because if it is a room is there, we can sterile it in properly, or case by case will take 1 hour or 1.5 hour time, and we can fumigate it, and we can prepare for the next case.
Yes.
But whereas in the multiple chairs are there, by the time it is not that much feasible for to keep the area sterile.
Yes. Dr. Sri Krishna and Dr. Nagendra, if there's some more questions that are general also,
yeah.
Now you can just take up those questions also.
Sri Krishna sir.
Yes, sir.
Sir, regarding this hospital setup, suppose college setup, we are having a number of chairs.
Yeah.
So by that time, how we can go for sterile the area, or we can keep the area for case to case?
Sir, the minimum recommendation is what is mentioned here. As we have seen, disinfection protocols have been mentioned. So some of them are not covered in the guidelines. As we know, not everything could be possibly put up here. There are no specific recommendations on that. In fact, it doesn't cater to even the teaching hospitals. I'm sure there'll be a lot of us who are working in the teaching hospital. There's no specific guidance on that. There are a couple of other interesting questions, sir, and repeatedly they have been asked. I don't know the answer, so I'm putting it up to you. The concept of extraoral suction, is it reliable? What is the advice?
Sir,
actually, I am taking that question. Extraoral suction is saliva ejector is totally, that is low vacuum suction should be avoided for all the procedures. High vacuum suction is advised, and 90% aerosol is sucked. Sometimes you can have your own design, some of them making, I do not know whether you will be able to see that on the slide in my hand, which is having a screen on the screen. It is designed, that particular equipment is designed with a cup kind of a mold.
Yes.
Yeah. Anyway, that is high vacuum suction only should be preferred in the day-to-day working.
One more interesting question is, can we charge PPE charges from the patients? If yes, how much should we charge? Is there any regulation on dental treatment charges by government? It's a very simple way of understanding. See, when so many new scares or so many new sterilization procedures or aseptic condition maintaining procedures come, like you're from a cloth mask, you've graduated to a 3-ply mask. From a 3-ply mask, now you graduated to a N95 mask, or from a film based X-ray, you have gone to an RVG. And as we are going up, we are not adding any extra charges. So it may not be possible to, it may not look good to charge an extra PPE charge, because this is going to be there for some time, maybe after the after the vaccine comes, and then suppose we may not be using a PPE. Will you say the patient will come and say, now deduct that amount? So it's always better to add it in the amount, whether you're doing a root canal with a RVG or whether you're doing with a film based X-ray. I hope you got my point. So it is always better to include it in the charge, because today the PPE will be there. Tomorrow, after the scare is gone and after the vaccine is there, maybe we may not, will come back to the original procedures. So these
thank you, Dr. Srikanth. Next question is on the consent form. Wanted to ask IDA about it, because IMA, IAP organizations have come up with their own consent form. Government of India has clearly stated that you take consent at the time of patient entry. So IDA, do you have the consent form, sir?
Yes, we have a consent form, and we have circulated to all our members, and we are all using it. We take a small questionnaire, whether you have cough, cold, whether you have fever, and we are just consent.
Dr. Srikanth, what Dr. Srikanth is mentioning, I'm adding a point to that. The consent form, when we are giving it to the patient in the reception or it is online available, in that we are strictly mentioning it, only one patient should be coming, no attendant to the clinic, unless it is mandatory that patient should be coming with an attendant, to avoid the risk factor, number one. Number two, also in the consent form, this is before the treatment, whatever they are mentioning, the consent form is submitted to us. And the patient, after the treatment, when they go back, every 24 hours, the office staff of our dental clinics are also going to inquire about their health condition next 14 days, just by SMS or by WhatsApp. We are also trying to make that protocol so that it is more adequate information we are getting on day-to-day basis after completing the treatment also.
Right, sir. A couple of other few questions before we wind up in 5 minutes. Sir, the question is, practicing in hot summer without AC, with PPE, advice?
It's not feasible, sir.
It is actually, this question is there for everyone. Unfortunately, the current available gadgets, what is available, many times when we are driving, we feel helmet is also difficult to wear. Are we wearing or not? Helmet is not comfortable for a short distance. People will feel that. Only thing is true in India, in Indian circumstances, the weather is so high temperatures. Maybe the month of May and June, if we pass through, relatively the temperature issue may settle. Anyway, however, that discomfort is there, number one. Number two, why we are all feeling this kind of a discomfort when you are wearing a PPE kit? One is correct size of thickness of PPE we are not wearing. Number two, our adaptation, particularly for practitioners, the adaptation time is required for a month or two, because we are all used to wearing an apron when you join a dental school in India and go out and working with an apron. But in today's first year graduate, if we trying to train them with an PPE, again with the modified PPEs with the lighter versions, once they come out, they will be more comfortable working with PPE. It's only that adaptation time is one point which is causing a big hitch to all of us. But unfortunately, till an alternate comes, whether to avoid PPE or some vaccination or by some other means we are protected, we have only choice to go with the PPE.
Thank you, sir.
And another point is there, and the question which I was reading on the screen a couple of minutes before, which was very, very important. Sorry to interrupt, Dr. Sri Krishna. That is very
Go ahead, sir.
So yeah. I'm just coming on that point. A question is that how to maintain the equipment in the dental clinic. That is the sterilization. See, you have the instruments which you sterilize, but the equipment, like many of the dental clinics are having a dental scaler machine. Like that, they have an X-ray machine. They have an microscope in the clinic. So the maintenance of them is 70% isopropyl alcohol should be used on a regular basis to clean that. But do not use a gauze piece or a cotton. Use a thin cotton which is prescribed for cleaning the surgical equipment, which is available in the surgical shops. Not the gauze, regular gauze or the cotton will not be sufficient to make it completely sterilized.
Very interesting question, sir. I'll put it up to IDA officially now.
Yes.
Sir, as a patient, I'm asking, how do I know whether the clinics are following the above guidelines or not?
Sir, now it is like it is all like a new beginning. How it is, I mean, it's a lighter vein. I am telling you, the life is so easy before marriage, isn't it? You don't have any responsibility. You are free. Now it is like post-COVID is you have to be more responsible, more organized, more systematic, and many guidelines are fallen in. It does require some time for all of us to adapt to it. But I am very sure that all our people are well equipped and confident to do this, and we are asking them to start working with the precautions and measures, whatever possible you are in your working environment, to start doing it. And of course, that ifs and buts are there in every profession, in any journey what we take up.
Dr. Srikanth, go ahead.
Up to all the new challenges. So, hello, can you hear me?
Yeah.
Yes, yes.
Now, in this new challenge, now you see there was some time back that the AIDS scare was there in a couple of years back. Then the hepatitis. Then see, at every point of time, the profession stood up to these challenges. Okay, and to gain the public what you call confidence, and so that the public are not scared away from the dental treatment. As of now, I think all our practice, whatever we are doing, whether with our following all the procedures and all that, our patients are totally taken care of. So it's to keep up the public trust, to keep up the patient trust, We have to have this kind of thing. So you cannot what you call think that how do I know? So let's say you remove COVID for 1 minute and you say, how do I know whether my doctor is having a hepatitis injection or not? How do I know when my doctor is using a glove? How do I know whether my doctor is cleaned up? It's all a matter of the trust that they build up all these years. That takes the procedure, the what you call.
Yes, sir. I think let me just extend this by a suggestion. What idea or could possibly do was prepare a checklist which says my clinic has these checklists already fulfilled. Proudly display it in front of your clinic. And, people now are more informed. As much as you know what to do, probably they also know before this come in. And this particular certificate under your, see, it can only be self-assessment. No one is going to go and visit. But this self-assessment checklist, if it comes from your organization or they with your support, even if it happens, this is a validation. So if you are writing a checklist signed and putting it on the door, probably people are more confident to step into that particular clinic than anywhere else.
Krishna's point is valid. I think we can circulate to our colleagues.
Yeah, we will design a checklist, design a format with the ideal logo, and we'll set amongst all the members.
Yeah, that should be. Nagendra, last questions. 2 minutes for you. It is recommended that we can reuse N95 by placing in paper bags. But what about the droplets that are there on the bag? And how do you now dispose of this bag?
With respect to disposing of the bag, it is as all the another biomedical waste we need to dispose in the red bag as it is considered as infectious. And with respect to the disinfection of N95, as far as AIIMS protocol, it is suggesting it doesn't suggest disinfection through the any liquid disinfectants, because that filtration rate and the capability of the filtration will get lightened. So that will no longer be a N95 mask if we start disinfecting it or washing it. So AIIMS doesn't recommend this. So keeping it for 5 days, we have seen that this virus can live a maximum of 2 to 4 days, as present evidence suggests that. So after 5 days, the 6th day, it can be used. So that is what the present protocol states. And that was a very good discussion for the last 10 minutes. To extend one point with respect to surface disinfectant. Yes, all clinics should regularly do surface disinfectants where all the high touch areas and wherever the patient care areas are there. So all those surfaces need to be disinfected. That should be, as mentioned by sir, with the isopropyl alcohol or bleaching solution. That should be done very frequently, preferably every 2 hourly, or after, if possible, the ideal setup is after every patient leave the clinic. Okay, so that
one good thing is most of the microbes are usually having this response to particularly even sodium hypochlorite. 0.25% to 0.5% can inactivate all the microorganisms, microbes.
Absolutely.
So that is one thing that we should always try to use. Whenever using hydrogen peroxide, it can be always with the addition of the other liquids. With that, it can be concentrated, like silver nitrate or the other compositions can make it more efficient.
So government of India. Yeah, just a last point. The government of India is also promote this 0.5% chlorine solution as the most cost efficient and most effective procedure for disinfecting of the surfaces. Absolutely. So I would recommend to have this bleaching powder with all of us, and as and when required, it can be easily prepared. All our sanitary staff can be trained in a 5 minutes, 5 to 10 minutes, and we should encourage this. This is a practice from last 2-3 years when this infection prevention has come up, but it's good that with this COVID thing, we are discussing more and more this step. And last one point which I need to mention here is, what about the efficacy of the negative pressure room? Government of India is suggesting a negative pressure room for all care of the COVID positive and COVID suspect patients. So it is ideal setup that if we could maintain a negative pressure room in our clinical setup, so that should be the best thing. So we need to look for it if possible.
Thank you, Nagendra. Question for
most of us, our clinic water connections are very, very important. That is, it should be having CFU. The measurement is done in 500 CFU is must. It is 500 CFU is colony forming units per ml is mandatory. That is, majority of the clinics will have. On and off, if you go for testing of that water, it is very easy to test. That is the recommendation. And so that the water whichever we are using is also very safe, which is not carrying microorganisms.
Yeah, thank you, Dr. Karnakar. Dr. Srikanth, can you respond to these questions in the Q&A box on IDA, along with the backflow issue? I'll take the last question on the vaccine. You can respond to the three of them.
There's one question from our incoming president, Dr. Aditya. How much is valid? How much valid are the consent forms with respect to the judiciary? Now here, the consent forms, as per the guidelines, already the Government of India has said you have to follow all the COVID regulations. So once you're taking a consent form, either way, you can take a consent form, pre-COVID consent forms or the present COVID consent form. It is a consent, is informing the patient. It has no validity in the court of law. There. If anybody has any extra point to share, please know that this is not a legal note, something that thing, but it is just to show that we have taken a consent from the patient and we have told him and informed him that all the COVID guidance are taking. This is from our lawyer only, our standing lawyer. We have taken a view very recently. So then, how effective? One more question, I think.
Sir, is there any regulation limitation regarding dental treatment charges?
No, there's no regulation in the sense. This is an unending topic we have discussed over the years, so many years. The thing is not about dental treatment or cost of the dental treatment that goes to the judicial problem. The treatment goes is they have been treated in a different manner. They have not been getting the actual treatment. The charges comes later. It's only that the charges complicate the matter. So there's no regulation as such. Nobody says you have to charge so much for a consultation. I may charge 1,000 rupees for a consultation. My fellow practitioner may be charging 500. Another person, if you go to government dental college, there's no any dental college, there's no consultation charge. So I'm just telling, dental colleges are free of course, but then when it comes to a private practitioner, there's no thing like that. It is, you charge as per how the patient, how experienced you are, depending on your capability over the years, how you have progressed. And there's even in the court of law, it does not stand anything that you charge so much or something. Maybe the insurance agencies, maybe these people, they have a pattern, like for Arogashri, Arogya Mitra, they all have this charges. So maybe when you're in that kind of a scheme, you have to charge according to that one. So once you're in a private,
yes, sir. Thank you, sir.
And most of the, sorry to interrupt, these pipelines which we are running, how to sanitize them, I think we can ask our Dr. Sri Krishna, sir, not Dr. Sri Krishna, the other friend.
Yeah, Dr. Nagendra.
Nagendra can give it us, because most commonly the microorganism seen is Legionella. This is the one which is traced in a lot of literature past 1 month, 2 months. So these pipelines, otherwise they will become the source of infection for us when we are working. So that's one line we can throw it, because most of our clinics earlier we were managing with relatively compromised working. So this will help most of us to equip with little maintenance of that equipment, which is required too. Legionella is the one which is commonly seen, that microorganism in most of these areas when they are.
Yeah, Dr. Nagendra, we are waiting.
Yeah, I think hypochlorite is what combination he advises we should be seeing.
Yeah. Sir, are we talking about the preparation of 0.5% chlorine solution?
Yes.
Yeah, so it is the general available bleaching powder, and it should be mixed with 4 teaspoons in a 1 liter of that, which will make up to a percentage of a concentration of 0.5% of chlorine solution. So which is documented that there is an evidence that 80% of all the bacteria and virus would be neutralized by using this solution. So it is essential that the proper mixing should be there, and a usually available bleaching powder, and that the mixing it should be in a proper concentration, which comes down to 15 grams per 1 liter.
Yeah. And important thing is, Dr. Nagendra, when most of the practitioners have one doubt in that, is one simple mechanism to.
Sir, you are on mute.
Hello?
Yeah,
Yes, sir.
Now we can.
Yeah, everyone has a doubt on this thing about the maintenance of the equipment. It is nothing great that again additional workload is there on the assistant. Only thing is the protocol should be followed properly. What this first thing is, the moment you have used the equipment on the chair side, it should go for the regular washing of the instruments for the washing of organic matter on that, the debris. Second level, it should go for the washing in the hypochlorite. Third level is use the soap solution to wash it, then go for the sterilization. So only thing is this line of management of instruments is important in the protocol to avoid the risk of this COVID before going to sterilization. So just take them out with and wash them in running water, clean the organic matter, then go for the hypochlorite rinsing, then go for the soap solution. Later should go for dry it and put it for the sterilization.
Sir, very rightly mentioned. I beg to differ on only one point, that
Yes,
immediately after usage of all our equipment, be it, artificial and all the instruments what we handle, that should directly go into the bleaching solution or any disinfectant.
Right.
Because there is a chance that if we directly wash in the running water, there is a probability that all that area would be getting infected. So there is a chance of spillage of that water, and again there is a risk.
I mean to say the running water area they are having, because the recently after these guidelines have come, they are going to have the hypochlorite, freshly mixed hypochlorite solution continuously available tap-side.
So
anyway,
the protocol says directly that should be kept in a hypochlorite solution for 10 minutes, and then wash in a not in a running water but a clean water bucket. So yeah.
Thanks, Nagendra. Last word, quaternary ammonia compound. How effective would you suggest?
I haven't gone through about that. I need to get back.
Yeah, because we didn't find it in the guidelines. Guidelines are very specific on what needs to be used. So I don't think it is as effective or proven to be more effective than the current protocols in place. Now, the last question, I don't find anything else. Dr. Srikanth, quick comment before I take my last question. OP cards, consent form, this could be another source of infection. What do you want us to do?
OP cards, consent forms. Okay, let's say we have gone electronic in everything, from giving appointment, from taking amount. I mean, we are not taking cash, not giving appointment or anything. Everything is electronic. So even this can be done electronically. Consent form, when your person is delivering your goods, he's taking your signature on the phone or with your hand or anything. There's no paperwork there. So I think that can also go electronic. You can have your tabs or something with a consent form, and the patient can put his thumb impression there or put a signature there and take a picture. And when that can go electronic as well.
Thank you. So that finishes all the questions which I've had so far. I think we've been able to answer most of questions. It's been more interactive than even what we presumed. We've been answering questions for more than 45 minutes now. Yep. So I take the last question, which is on vaccine. Lot of developments on the vaccine front. I would say that we are not at a stage where vaccination is now our recourse or the panacea for all our issues. We need to modify, adapt, and our lifestyle has to be in sync with the current situation. If it was lockdown, it was supposed to be like that. Now post-lockdown, with public transport available and people coming back to their workplace, we also need to adapt. The preventive measures stay the same, and as I said in my presentation, the virus stays the same. Its microbiology stays the same. The potentiality of infection is the same. So we need to ensure we learn more, understand it more, continuously adapt, understand what the new guidelines are, trust them, and start working from there onwards. And this is going to be a learning process. Probably next year we'll be discussing how we have handled this and how we would have handled it better. And I'm sure this will come up in textbooks later also as essay questions for all the undergraduates at various levels. But we have hope. The good part is we are able to connect to each other. I would say compared to the earlier pandemics, there is much better understanding of what is happening. A lot of ongoing research, even if it is just 2-3 months old infection, and we are quickly adapting. And I'm sure this is a good sign for us. So that's all from my end. We have closing remarks from Dr. Karnakar, Dr. Jagdish, and then vote of thanks by Dr. Srikanth. Dr. Karnakar, sir, 3 take-home messages from you.
Yeah. First of all, I sincerely thank UNICEF for taking up such a noble cause and initiative to our practitioners nationwide. I am getting many of them are messaging me that it was a very useful webinar. However, I would like to have this panel discussion even in your office. It would be more closed door working up with the elaborate plans next time. And to all the participants, viewers who have taken out their quality time and viewed this program, they can give the feedback for upgrading our presentations next time. And all the practitioners, I am very sure that this webinar will definitely contribute in their day-to-day working and boost their confidence in working. I am reassuring everyone that this particular phase of COVID is not to worry or run away from the problem. We are having all confidence to move forward and face the challenge and go to clinics, get back to work, and render our services. Thank you very much once again, UNICEF, for giving us the opportunity. No distance is longer with a good company. Though it is more than 2.5 hours, we felt the time is still short. Thank you very much indeed.
Dr. Jagdish.
Thank sir, Dr. Sri Krishna sir and Dr. Nagendra sir. Thank you very much. And on behalf of IDA Deccan branch, it is eye-opening for all the practitioners, and you are given extensive exposure on COVID-19. It is very, very useful for all the practitioners. I think all the practitioners should follow whatever the guidelines of central government as well as ICMR. So if they follow the guidelines of central government or ICMR, so it won't affect they can run the clinics without any hesitation. But whoever is not following the guidelines, they may face the problem. So little bit they should take care of their patients as well as themselves, doctors. So this is my sincere advice and sincere thanks to once again Sri Krishna and Dr. Nagendra. Thank you very much.
Yeah. So, thank you, President Sir, Dr. Jagdishwar Sir. On behalf of the President, the Executive Committee of the IDA, I thank all the 200 plus doctors who have attended this webinar, and that too at a very short notice. I think Dr. Sri Krishna and Dr. Nagendra, when you have approached just 2 days back, and we have played the message, and we wanted a lot of people to attend, and even Dr. Karnakar and Dr. Jagdish also, they agreed immediately to, because we were not having that much information. Everything is in the WhatsApp. Everything has to say, nothing is there in the paper. But immediately they took out printouts and read whatever they could. And I'm very thankful that for all the members supporting so many questions, I'm sure we can have more number of speakers and more time in the coming days, and we can plan for more programs like this. We are very indebted to you, Dr. Sri Krishna and Dr. Nagendra, from helping the association coming together especially during these troubled times and clearing out so many myths and issues with the doctors had. And surely we'll work out for one more program in the next coming days, because the lockdown period, people are very busy now. All the practices have opened from morning 6 to evening 6. We're just trying to attend to as many patients as possible. Most probably we'll have it after the lockdown period, in the sense after the lockdown time every day. So we need not wait for next Sunday or anything. In between, if we get another good batch of speakers or more number of speakers from more out of Hyderabad or national level, also we'll get them. We'll make them attend, and even the weekdays also, if it's possible, we'll do it. Thank you very much.
Yeah, thank you so much, Dr. Srikanth. It's all your support. Our intent was to just ensure that this message from Government of India goes out to every practicing dentist. That's the only way in which we can contribute. And on behalf of UNICEF, let me promise all the support. As you are aware, this particular Zoom pack has all the security features enabled. It may be a new experience. I remember you asking me, how come you can't see each other? But that's how it is. That enables the security. That enables that people who are actually seeing can see only 5 of us as we're talking. And all these features, will be happy to share this as a webinar for you for IDA. may I request in the coming days, as soon as possible, probably by this month end, let us come up with a checklist, a one-pager under the logo of IDA, which says this particular clinic has these 10 parameters in place. Let us proudly display it at our clinics, and this is the way in which we tell our well-informed patients, my clinic confirms to this. And sometimes once you vouch for it, you end up doing it. It may not be the other way around.
Yes.
Once you write it and keep it on your door, then you end up doing the disinfection. I said in my slides, floors to be cleaned every 2 hours. Yes, that is what is written in the guidelines. I had to say it. Now that you say it in the guidelines, now that you write it and say my floors are cleaned every 2 hours, now it is imperative on us to do it. So UNICEF will be very happy to come out with this checklist. And these are some good practices. We'll try to share it with ministry as well, because ministry constantly asks us what are the good practices from the field. And I would like to report in the month of June that this is something which IDA Telangana has taken up. And I'm telling you for sure, this is going to be quickly catched up by other associations and also IDA of other states. So thank you so much. And it's very nice if one webinar leads to a set of advocacy actions. We were not looking at a one-time activity. We want to engage on a continuous basis. Thank you, Nagendra, my colleague, for supporting me all through this. And this session was live on YouTube in the link. And please share this session with others who might have missed or would like to read or review these sessions again. So that's all from our end. Thank you, Dr. Karunakar, Dr. Jagdish, Dr. Srikanth, and the entire IDA team for the support. I'm exiting the meeting, and I request all the participants also to press on leave meeting so that you exit it once. That's all from our end. Thanks, everyone.
Yeah. Thank you.
Thank you.